Hello and welcome. Thanks for joining me. The month of October is particularly crucial for the whole world. Why is that? Well, it's because it's the month breast cancer awareness takes the spotlight. So today, rather than bring you the concluding parts of the dental care episode I started some time ago, I will beam light on breast cancer and the awareness initiative. Right, so let's begin with this report on breast cancer. I'll be right back.
Breast cancer is an illness that affects millions of people around the world. The most common cancer among women and the second leading cause of cancer death after lung cancer. It is believed that while about 1 in 8 women will get invasive breast cancer in their lifetime, the male folks are not 100% spared. So, to drive home the knowledge about the disease, October became the Breast Cancer Campaign Month, raising awareness, supporting those affected, promoting early detection, and encouraging survivors to share their stories. Early detection has been said to be the key to increasing survival rates, as catching the disease in its early stages allows for a wider range of treatment options and significantly improves outcomes. According to the World Health Organization, more than 2.3 million people were diagnosed with breast cancer in 2020, and nearly 685,000 died from the disease. However, the good news from these alarming statistics is that advancements in research, treatment, and screening methods have led to higher survival rates over the past decades. Some risk factors associated with breast cancer include age, family history, certain genetic mutations such as BRCA1 and BRCA2, lifestyle factors such as alcohol consumption and reproductive history, among others. To help circumvent this ailment, early detection, which is quickened by self-check, is of great importance. Lending its voice to this year's campaign in Nigeria, American Corner Ikeja, Lagos, held an exclusive breast cancer awareness program, and a survivor shared her journey.
My journey was not easy. As a matter of fact, even after active treatment, I still have side effects. There is lymphedema, there is numbness. So cancer journey is not an easy thing. It's never easy.
So the watchword is stay informed, get screened, and spread the word. The disease may not be the end for you.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only. I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Welcome back. If you're just joining me, I'm talking today about breast cancer. So, to put some related issues in proper perspective for us is no other than Dr. Adaora Enyi, who is an oncologist. I cannot begin to reel out all of Dr. Adaora's profile, but it's important you might have. So, let me give you the snippet of who she is. Dr. Adaora Enyi is the co-founder and chief operating officer at Oncopody Technologies, a digital health innovation company empowering confident cancer care decisions by patients, clinicians, and healthcare companies. She also serves as Director of Innovation at Pearl Oncology Specialist Hospital, a hospital which is a comprehensive research and digital women's cancer center. So welcome, Dr. Adaora. Thanks for joining me on this episode. So I just want to know, we already have an idea what breast cancer is. And we know that it's Pink Month, right? But I just want to kick off with a general question. So, what are the risk factors for developing breast cancer?
Okay, so thank you so much for that question. So for the risk factors for developing breast cancers, we like to divide them into two parts. That is the modifiable risk factors, that's the ones that we can really do something about, and then the non-modifiable risk factors. Now, the non-modifiable risk factors will be factors that, as a result of who or what we are, we can't really change much about those. So let's start with the non-modifiable because we can't really influence that. So firstly is that if you're a female, that's a non-modifiable risk factor. You can't change your gender. So you are at risk of, getting breast cancer. If you have a breast, right, you are at risk of getting breast cancer. Then for people with a family history, or what we call the direct genetic factor, which is present in about 5% of the population. So those that have the BRCA1 or the BRCA2 genes, right, are at risk of developing breast cancer. Then modifiable, other non-modifiable risk factor would be increasing age. So the older you get, then you are at risk of getting breast cancer. So once you're increasing in age, you can't change anything about your age, right? You can't decide that you don't want to grow anymore. If you don't want to grow anymore, then you most likely die. That's another non-modifiable risk factor. So let's come to the modifiable risk factors. So the modifiable risk factors are those factors that, as a result of certain things that we do, right, it predisposes us to, by these factors, chances are that we may not get breast cancer. So what are some of these modifiable risk factors? Number one, nulliparity. So nulliparity means a woman that has never been pregnant before, meaning that if you get pregnant, you get protected against breast cancer. For women who have their first delivery over the age of 30, right, you are at risk of getting breast cancer. For women who have using frequent use of oral contraceptives increases your risk of breast cancer. For women who are on some form of hormone replacement therapies for other conditions, it predisposes them to breast cancer. For women who start their menstruation really early, the normal age of menstruation should be anywhere around 12 to 13, 14 years of age. But if you start menstruation very early, that means you start menstruation as early as 9 years of age, or you end menstruation, that is, you arrive at menopause, right, very late in, and that allows you to be really, really exposed to the hormone called estrogen, which is actually one of the hormones implicated in breast cancer, then you are at a higher risk of developing breast cancer. And then, of course, sedentary lifestyle that predisposes you to to obesity also improves or increases your risk of developing breast cancer. Then poverty is just something that goes across all types of conditions. Poverty increases your risk of breast cancer and any health condition.
Wow, interesting. I just want to know, because you talked about only females. Is breast cancer only found in females? Because I've read, of some, factors or not factors. I've heard of some issues in male too, in the male folk. So can you shed a little light on that as well?
Oh yes, absolutely. Although breast cancer affects females, I'm happy to, I can tell you for a fact that breast cancer is also seen in men, because men or the males do also have the organ called the breast. It's just that it's not as prominent as that in females. Breast cancer is just 100 times more commoner in women, which means that for every 100 cases of breast cancer that we see, one of such cases are actually affecting the men. So the men are actually implicated in breast cancer. So 1 in 100 breast cancer cases will invariably be the man.
Okay, thank you for that. So, but is there any connection between genetic factors in contracting breast cancer? Is there any connection?
Also, absolutely, there's a connection with breast cancer. So as I explained in the non-modifiable risk factors, if there's a family history of breast cancer, ovarian cancer, then you are at a higher risk of breast cancer. And if you have the directed genetic factor, which I say is only present in about 5% of the human population, right? So you have the BRCA1 and the BRCA2 genes, then you are at higher risk of developing breast cancer. So yes, genetic factor plays a role, right? However, or sadly, it's important to note that more than 60% of breast cancer cases that we see are sporadic, meaning that there's no known cause, right? There's no known genetic factor implicated. There's no family history. And many times when you go through the risk assessment, their risk assessment is even very low. So 60%, more than 60% of breast cancer cases are actually sporadic.
You talked about usage of contraceptive the other time. But we know this is about the only way women or a family protect themselves from unwanted pregnancy. So does that mean we should stop the contraceptives altogether if the result is going to be increase in breast cancer?
No, so we're not saying to stop oral contraceptives completely, right? We're just saying that if you do take oral contraceptive, please know that your risk of breast cancer is higher. But we've had cases whereby a patient has been on oral contraceptive all their life and they didn't come down with breast cancer, right? So it's like robbing Peter to pay Paul, right? You just have to pick one of two poisons, which one actually works for you. Just as we will not say, because we say, oh, getting your first delivery over the age of 30 years, predisposes you, increases your risk of breast cancer. We're not now saying that, oh, make sure you get pregnant before you are 30. Or we are saying, oh, nulliparity increases your risk, meaning that if you've never been pregnant before, you're at higher risk. We're not saying that once you're a woman, you should always be pregnant at every point in your life. No. But we're just saying that these things, from studies that we've done over the long periods of years, across several years, has been linked, right? But these links are not direct links to say that, oh, if you take this, then this is the exact outcome. There are still other variations that will come into play. For instance, I have a patient who has a family history of breast cancer, right? But however, the family history of breast cancer was implicated in their second degree relative, not the first degree relative. And even when she herself did her genetic testing, there were no genes implicated, right? And so there was really no preventive measures other than regularly doing a mammogram screening and then checking other aspects of our breast regularly, like doing a clinical breast examination. But other than that, was good and there was nothing. But we've also had cases of patients who don't have a family history, who, when you look at their risk assessment, they are not nulliparous. They've had their first children even before the age of 30. They are not even on any oral contraceptive. They are not on any hormone replacement therapy. They started their menstruation at the right time. They've probably not got into menopause yet, maybe because they are just still in their early 40s, right? They're not even obese, right? So all of those risk factors, they don't check any of the boxes, right? But eventually they do come down with breast cancer. And which is why we put out that disclaimer out there to note that breast cancer cases, 60% of the cases we will see are actually sporadic, meaning there's no direct link to what had caused them to develop breast cancer.
Wow. As what role as lifestyle choices then, we can't pinpoint anything particularly, what role then as lifestyle choices got to do with the disease?
So I would say that in terms of breast cancer, the role that lifestyle choices has to play, it has to do with, sedentary lifestyle, right? You want to make sure that as a woman or as a female, you want to be as active as possible, right? Because breast cancer is more preeminent or will not be noticed early enough in cases whereby the breast tissue is very, very dense, right? You want to make sure that you're within the normal BMI, right? You're not obese, you're regularly exercising, you're eating right. Because whether you like it or not, eating right protects you not only just from breast cancer, but from all and several health conditions. So making sure that you're eating right and making sure that you're exercising, that you're within normal BMI. So eating right would entail ensuring that you're eating your green leafy vegetables regularly, you're eating your salads, right? You're not just only consuming junks. You're not just only consuming soda and carbohydrates, right? You're taking foods that are rich in amino acids, that are rich in minerals and vitamins, right? You're making sure that you're eating your nuts, right? So you think of nuts like your bambara nuts, your berries, right? Your walnuts, your almonds, right? You're ensuring that you're eating foods that are low in cholesterol, right? So you're shying away and avoiding things that are or your oil-based foods, right? And making sure that even if you must prepare foods with oil, you're taking very minimal oil. Then you also want to make sure that you're taking lots of water in a day, right? You're taking at least 3 liters of water in a day, regularly consuming water. And more importantly is that you also want to make sure that you start your day and you end your day with water, right? You don't start your day with puff puff or chin chin or snacks, right? Right? You want to start your day with healthy food options, healthy meal options. You want to eat your efo, your greens, your salads, your lettuce, your cucumbers, right? Just making sure that you're eating healthy. We're not saying cut out rice completely. If you're eating rice, let one portion of your food be rice and the other 2 portions be your vegetables.
Okay, greater percentage of people, I must admit, don't go to the hospital unless there are symptoms or, of a disease. I probably won't go to the hospital in a year if I don't have a headache, for instance. But if it's persistent, I'll go. So what are those symptoms of breast cancer you think everyone should take note of?
Yeah, so the sad reality is that for breast cancer, the symptom is something that you can easily miss, right? And you can easily miss it because you're not checking. So the commonest symptom of breast cancer is a lump in the breast that is usually painless. Now, imagine women that have really large breasts, right? If you're not regularly checking your breast, you would miss a lump there. You will miss one very tiny lump that is as tiny as a little stone, right, in your breast because you're not regularly checking your breast. And because this lump is painless, there's no indicator to say, oh, there's something actually happening, right? So many times it goes undiagnosed and unnoticed. We usually now notice it when there's now a discharge from the breast, right? Many times a blood stage discharge from the breast or from the nipple, right? When maybe the nipple now begins to retract, there's some form of retraction in the nipple, or when there's some form of distortion or puckering around, the breast, right? Or what we refer to as pure d'orange. So take, for instance, the way an orange, and I think luckily I have an orange. I have an orange here. So you see how this orange is not smooth, right? It seems to have like some puckering around the skin. Imagine your skin that ideally should be as smooth as mine. It now begins to look something like this, right? It has some puckerings, right? It doesn't look nice anymore, right? That's really many times how many of these women would present, right? And then sometimes there can even be a lump in the armpit, right? Then of course, when this breast cancer has really advanced and it has gotten really, or there's some form of metastasis, you now start having, or evidence of spread, you now start having patients coming down with chest problem, they're having difficulty breathing, they have chest pain. That means there's some form of metastasis to the lungs, or they're having difficulty walking, or they're having bone pain, then there's metastasis to the bone, or they're having problem with excretion, right? They may even come down with jaundice, right? Or they're having distended abdomens, right? And there's a problem with their liver, right? So that's when breast cancer has actually advanced, right? But many times, or the most commonest symptom is that painless lump, which is usually missed in breast cancer cases.
How often should one self-examine the breast? How often?
So in terms of self-breast examination, I always say that every woman should know their breast, and even men, you should know your breast every month. For women, usually I would always advise that you check your breast at least a few days after your menstruation has ended, right? So within the first 10 days of your cycle length. So that means if your menstruation lasts about 3 to 5 days, then you want to check your breast about 3 to 5 days afterwards, all right, after that menstrual cycle has ended, right, so that you can notice any changes, right, around your breast. And if there's anything that is happening, you would actually notice it. So, but you want to make sure that you're doing this every month. And how do you want to do this? You typically want to do this in the morning after you've had a cold shower, right, in preparation for work. So when you are still wet, stand in front of the mirror and you've just come out of the bathroom.
What about people who don't bathe with cold water? Because you specifically say cold shower. Does that have anything to do with it?
No, so it just makes touching the breast and noticing anything that is there better. If you did a warm shower, then your body will be hot. Then if you're feeling anything on your breast, because of the water you've had, the hot water, it will almost feel like as if, there's a form of warmth in your breast. But if it's a cold shower, if there's something there and it's actually warm, you would actually notice it that, this part of my body feels a bit warm, or this part of my body feels a certain way. And then because you're checking for a lump, right? And many times this lump may even be mobile. It may not be attached to anywhere. If you take a cold shower, it's easier when your hands are cold to actually feel for something, right, that is moving about than when your hands are hot or when your body is hot. So stand in front of the mirror, right? Put one hand at that akimbo or over your head, right? And then check. And then you want to switch to the other hand and also check your breast and also check your armpits, because as I said, one of the symptoms is that there can be a lump in the armpit. So you want to check your breast with the other hand, with the adjacent hand, and also check your lump. Know how your breast feels like. Check if there's any discharge from your nipple. Check if there's any change to how your breast looks or feels. If there's any distortion. If there's any puckering like an orange, or if there's any discharge. And once you do that, you want to do that every month during the early phase of your your cycle. That is a few days after menstruation has ended. For my men, I also advise that maybe every first of the month, you just want to check your breast, right? As part of your routine body check. Just you yourself touch your breast. The sad reality is that many times, most women that come to the hospital to actually present, right, is either when their husbands or their boyfriends or significant other has actually touched their breast and noticed that, there's something in that breast that they didn't know before. So even you as an individual, you should know your own breast. It shouldn't be somebody else, notifying you that there's something different.
Okay, you've heard it all. The first step is to self-check and then do the test. Right, today I'm feeling gifty. Never mind, that's my own terminology. I'm giving out gifts on the show. But for you to be a partaker of the gift, there's a caveat. And the caveat is you must watch, like, and turn on the notification button for Talking Health. And to enjoy the freebie, which I'm giving out, you have to send me proof by chatting me up. You chat me up only on 08033 220367 or 0907 004 7949. And then when you do that with a proof, you get a 50% discount voucher from me. Yeah, from me. And that will take you to your next dental clinic. That is 50% off your dental charges. Yes, I promise you, you will love it and want more, like ice cream. Okay, so you don't want to miss this wonderful chance, I bet you. Chat me up on the numbers I just read out to you, which are also on the screen right now. And that's how I wrap up today's edition. So keep a date with me next time when I shall be bringing you the concluding part of the dental care episode. Until then, think health matters. Think Talking Health with Bumi. Bye for now.